So you know how other medical vloggers show different scenes, like them driving to the hospital or walking through the hospital or eating their lunch at the hospital? Well, I'm sorry, I'm not gonna be doing any of that. I'm gonna be sitting in this room, in this chair, so I hope you don't get bored. Okay, fine. If you really want to see the different backgrounds, I'll go ahead and get that out of your system right now. This is me in my bathroom. This is me in my living room. This is me in my kitchen. This is me outside of my apartment. This is me outside my apartment. If you actually look all the way down there, that's the hospital. So I actually live on hospital grounds. All right, so I'm about to go back inside because it's cold as Hi, my name is Jennifer and welcome to Jenn's Med Life. Today I'll be discussing my urology surgery rotation. So the surgery rotation at my school is 12 weeks compared to other US schools, which is about 8 weeks. If you didn't already know, I go to a Caribbean medical school and they offered a UK clinical track, so I decided to come home. The first 2 weeks of my surgery rotation was urology, so that's what this video will be about. So what is urology? Urology is a branch of medicine that focuses on the surgical and medical diseases of the male and female urinary tract system and the male reproductive organs. So yes, I saw a lot of eggplants and tomatoes, especially older eggplants and tomatoes. I actually got to see a lot of surgeries during my first 2 weeks of urology, 30 to be exact. And out of that 30, I assisted and scrubbed into 6 of those surgeries. So before I get started, I want to tell you 2 fun facts about rotations here in the UK. First one, over here they call the OR a theater. Second, all the male surgeons are called Mr., all the female surgeons are called Ms. It's actually somewhat offensive to call a surgeon a doctor over here, which I think it's so hilarious because in the US, you better call all doctors doctors unless they specify otherwise. Can you imagine me going up to a doctor in the US and being like, "Hey, Mr. Foot?" He would be like, "Excuse me, that is Dr. Foot to you." And the nurses over here are called sisters, but I think it depends on what level you are because they have different names. It's actually very confusing. And I'm not sure what they call the male nurses. If you are a nurse in the UK and you understand the whole breakdown of each name and everything, please leave in the comment section the descriptions. I would really appreciate it. I asked my friend who was a doctor here in the UK, and honestly she was just as confused as I was, and we were just dying laughing trying to figure it out. So I would really appreciate it if you're a nurse in the UK and you can explain that to all of us. Thank you. So my first day of rotations. That morning we had orientation, and that afternoon they literally just threw us into surgery, like, okay, go ahead, go see some surgeries. I was like, cool. So when I went into my first surgery, the surgeon was like, okay, go scrub in. I was like, I don't know how to, but cool. So one of the nurses showed us how to scrub in. It was me and another student. My very first surgery was a direct inguinal hernia repair. I was like a kid in a candy store. I wanted to touch everything and I was asking all the questions. I also got pimped by the surgeon. She asked me about 3 questions and I got about 2 out of the 3 questions right. I was so proud. She let me feel the ACEs and she let me touch the spermatic cord. It was so amazing. Towards the end of the surgery, I tried my luck. I asked the surgeon,
"Can I please close the patient after you're done?"
She was like,
Whoa, let me finish what I'm doing first.
She was a scary Asian lady. She scared me. Then she pimped me again and she was like,
What sutures do you know how to do?
So I was like,
"All of them?"
and I started naming each one. Long story short, she said yes, so I was able to throw 1 subcutaneous interrupted suture and she let me inject lidocaine into the incision. Y'all, this was my first few hours in the hospital. I was so excited. My second surgery for the day was unrelated to urology, but I observed a lower uterine segment cesarean section, so basically a C-section, and I loved it. But as soon as the baby came out, I was so distracted from the C-section. I started looking at the baby instead of the C-section, and he was just so damn cute. I love babies. So that was my very first day. For the rest of the 2 weeks, I'm gonna list the surgeries that I scrubbed into and assisted with. Then I'm gonna list the surgeries that I observed that was related to urology, and then I'll list the surgeries that I observed that was unrelated to urology. By the way, if you see me looking down at my computer screen, it's because I recorded each surgery. So I recorded the date of the surgery, the number of times, the surgery type, how much responsibility I had, and any takeaway points that I got from the surgery. So the surgeries that I scrubbed into. The first surgery that I scrubbed into was an orchidectomy, and it was an excision of the head of the epididymis. I assisted in closing the scrotum with an interrupted vertical mattress. The second surgery that I did was a pantaloon hernia repair, which is both a direct and indirect hernia, if you didn't know what that was. I assisted with holding the instruments, keeping the incision open, and I assisted with closing of the incision. And the stitch that I did for that was a continuous subcuticular suture. The third surgery I scrubbed into was a scrotal exploratory and orchidopexy of an undescended testicle. I assisted with holding instruments, and I got to feel on some of the internal structures. For instance, I got to touch the vas deferens. Yo, quick side note, this undescended testicle was so tiny. Like, it was a boy, but his regular testicle was so much bigger than the undescended testicle. And it was so tiny, I was like, oh, it's so cute. And literally the whole theater died laughing at me. The fourth surgery was a mouthful. It was a laparoscopic laparotomy, drainage of an abscess, and the resection of 2 bowel loops. So yes, it was one long surgery. And I got to cauterize bleeding vessels, and I stapled the skin closed. That was actually really fun. The fifth surgery was a scrotal exploration. So, side note, whenever you have a boy with testicular pain, you want to assume a testicular torsion. So you rush into the OR or the theater, and you open up his scrotum to see if his testicle has twisted on itself. In my case, we opened him up and he was fine. So all they did was just cut the appendix off, and we closed him back up and sent him home. In that surgery, I assisted with holding instruments and holding the scrotum. And last but not least, the sixth surgery that I scrubbed into was a scrotal excision of Fournier's gangrene plus debridement. So yes, this guy had gangrene on his scrotum. His skin was literally turning blue in a matter of hours. Gangrene spreads fast. It was a disgusting surgery, but it was also actually pretty amazing. So I assisted in holding the scrotum in place for the debridement, or as in the UK they say debridement. So the surgeries that I observed. I saw about 3 TURPs, which stands for transurethral resection of the prostate. So this surgery is used to treat urinary problems that are caused by an enlarged prostate. So basically BPH, which is benign prostatic hyperplasia. Y'all, like, kid you not, this surgery literally looks like kebab being scraped. I love kebab. The second surgery I saw was a TURBT, TURBT, which stands for transurethral resection of a bladder tumor. The third one I saw was a hydrocelectomy. Fourth one was a bilateral orchidopexy. Fifth one was a diagnostic cystoscopy and removal of a stent. The sixth one was a diagnostic rigid cystoscopy and bladder biopsy. The seventh was a stent placement into the UPJ, which stands for uteropelvic junction. The eighth one was a rigid cystoscopy and a cystolitholapaxy. Whew, that's a mouthful. The ninth one was actually a second scrotal exploration. It was another boy with a suspected testicular torsion, but when we opened him up, he was actually fine. The 10th one was an excision of multiple calcified scrotal sebaceous cysts. So the guy had like 7 hair follicle cysts on his scrotum. So they just looked like a whole bunch of bumps. So some of the bumps that we opened up, about 2 of them, were these really small calcified structures, and they call them pearls. So the surgeon was like, which is more valuable, a clam pearl or a scrotal pearl? And the last one that I observed was a JJ stent placement. Surgeries I observed unrelated to urology. So I saw my second direct inguinal hernia repair. I saw some teeth extractions in the ENT OR. I saw a lipoma excision biopsy of the posterior thigh. I saw a biopsy of the leg with a skin graft. I saw laparotomy and reversal of the ileostomy and ileocecal anastomosis. I saw a vaginal vault repair from the prolapse of her bowel. Yes, her bowel was literally falling out of her vagina because she had had a hysterectomy that got infected and the bacteria literally ate through the wall of her vagina. It was amazing. I saw a diagnostic laparoscopic appendectomy, and this guy's appendix was so infected that there was literally no appendix to remove. It was just an abscess, like the bacteria had ate through his appendix, completely dissolved it. And the last surgery that I saw was a laparoscopic excision of the endometriotic tissue plus a progesterone coil insertion. And that was pretty cool because I got to see the peristalsis of a ureter. It was like how I studied. So I tried to wake up around 5 a.m. every day to knock out about 40 practice questions, heavy on the try. And then I was at the hospital by around 7:30 to 8 a.m. We started with ward rounds, which lasted about 2 to 3 hours depending on the cases that were there that day. Then I had some downtime to study during lunch. This is when I did emboss or UR practice questions on my phone, or when I studied Pastana surgery notes, or case file surgery. And I actually don't eat breakfast or lunch because I intermittent fast, so I have extra time to study. By the way, this hospital was so amazing because they gave us all these books for free. So after lunch, we were usually in the theater for the rest of the afternoon till about 5 p.m. or 6 or 7 at the latest. And whenever we were waiting for a patient to come down for surgery, I would take that opportunity to study or do some more practice questions. I would even study during some of the really long surgeries that I was just observing. And honestly, y'all, by the time I got home, most days, I was just too tired to look at any other reading material. So I just took a shower and relaxed. So more of the story is just study whenever you can, in every opportunity that you can. So the question we've all been waiting for, well, at least I was waiting for. Can I see myself doing this for the rest of my life? Yes, I actually really enjoyed my urology surgery rotation. Like, I think it's an amazing subspecialty, and I'll be very interested to see what other specialty can top this one. So that was my urology surgery rotation. I hope you really enjoyed it. Please like, comment, and subscribe to my channel, and stay tuned for my next video, which will be on my 1-week breast surgery rotation. So I'm actually about to go record another suturing tutorial, so please go ahead and subscribe to my other channel, JennMedArt, to check out that video. Alright, it was nice talking to you guys. See you later. Bye.